My name is Felicia McNeil. I'm a student at Indiana State University, LPN to BSN Community Health 444, Dr. Lucky's class. And today I come to do a presentation about facts you should know about gonorrhea. So this is a series in the STI infections. This is actually my last video that I'll be doing, but I have six other videos total that you can pull up with the same title, but just different disease process. So today we're going to be talking about facts you should know about gonorrhea. So before we get started, I have a pretest. If you click the link down below, you'll see the pretest. It has 10 multiple choice questions with 4 answers each. And we'll go through these questions during the actual presentation, but if you see it's 10 total. So I'll let you guys go ahead and take the pretest and we'll be right back with the presentation. Thank you. All right. Hope you guys are ready. Hope you guys did great on the pretest. And now we're going to get into the actual facts you should know about gonorrhea. So first, what is gonorrhea? Gonorrhea is a sexually transmitted disease that affects both men and women. It can cause infection in the rectum, genitals, and throat. Per Easton 2018. It is common amongst teenagers and society itself. So the age range is between the age of 14 to 59. That's the age range that we're going for in this project. So first you ask, how is gonorrhea spread? So gonorrhea is spread by having vaginal, oral, or anal sex with an infected person. Also, pregnant women can get this disease also, and it can be transmitted through the birth of the child. So why is gonorrhea serious? It's like, oh, it's just an STD, it's not that bad. No, actually it is. So gonorrhea can lead to permanent damage to the sex and pelvic organs. It can cause sterility in men, and it can cause women not to be able to carry babies because it causes issues with their fallopian tubes. So many people are unaware that they have gonorrhea infections, hence failing to be treated with the disease. This is not one of the diseases like AIDS where it lies in your body for a while and you don't know you have it. So with gonorrhea, you're definitely going to know that you have it because the symptoms with this, as far as being treated, so symptoms of the gonorrhea is painful urination, discharge that's like pus-like, it's like a greenish color. And so I have a picture. This come off the CDC website. So gonorrhea is also known as clap. They call it the clap, like back in the day. Today they just call it gonorrhea, just a STI infection, but that's another name of gonorrhea. So you see where people get it on the hands, they've had it on their feet, and it actually shows the bacteria growth in like pustule cells and the leakage out of a male's penis. So if you look here, this is the actual growth of the virus here. This is on a slide magnified probably 400 times. This is the leakage, the drainage out of a male's urethra, the head of the penis. This is it on the hand and on the feet. And like I said, that comes from the CDC. Other ways, women may have painful urination as well as also men, frequent urination and a gray or yellowish discharge. They may have heavier periods and bleeding after sex with low abdominal cramps. And if you're having rectal sex, anal sex, then you'll have some drainage and leaking from that area as well, but it's greenish discharge. And the same symptoms are the same for men. They have a greenish or yellowish discharge, but I will tell you this, men experience symptoms faster than women. Like within 2 to 3 days, the male can tell that he has a STD. He's coming in to be checked like something's wrong. What do you need to know about gonorrhea? Make sure you get checked. If you're sexually active, make sure that you get your exams. Especially if you're with a new partner, you want to make sure that you get checked. And the best way to get tested is For females, you have it's called a pelvic exam, where they take swabs from the vaginal area is how the females get tested. Men, sometimes they can test it from urine. You have to have 30 cc's of urine in a cup, and it's sent down to lab. And with with men also, they've been known to use swab. So when the males are swabbed and when the females are swabbed, these are the swab samples that they use when they're swabbed. So this swab right here tests for GC and chlamydia. So normally when you have gonorrhea, you may have chlamydia too. So they test and treat for both. So this is the swab that goes down the tip of the head of the penis. You put it down, swab it, and it goes in this kind of device and it's sent off to a lab somewhere is what they use. And the same for women. Theirs is with a pelvic exam, same swab, and it's sent down in the same tube. That's how that's done. So how can you protect yourself from getting gonorrhea? So the only main way to protect yourself is abstinence, not to have sex. But if you are having sex, make sure you use condoms or dental dam if you're having oral sex. Do not sleep with someone who's infected because they can infect you. Now, women that have sex and have gonorrhea, your baby can come through the birth canal, but it can cause blindness in infants. And you definitely want to make sure you're treated. Women also go to the health department to be seen for prenatal and their doctor's office. So they test you quite a few times during pregnancy to make sure you don't have any venereal diseases. Can I get cured when I have gonorrhea? Yes, gonorrhea can be cured. So the medication they use, normally they use two in combination. They'll use Rocephin or azithromycin. Those are two drugs of choice that they use to treat this medication. And you are not to have sex for 2 weeks after you get the medication, because that's how long it takes for it to clear. So what happens if you don't get treated? Untreated gonorrhea can lead to permanent and severe health changes in men and women. And women can lead to pelvic inflammatory disease, PID, accompanied by such as formation of barriers that block fallopian tubes, which cause sterility and you can't have babies, ectopic pregnancies, which is a pregnancy in the tube, infertility, where you can't have children at all, long-term abdominal pain. In men, the disease can cause testicle tubes, really cause men to be sterile. So untreated gonorrhea can increase your chances of getting HIV infections. Look at my other video. We just talked about HIV as well. So you definitely want to make sure you're protecting yourself. So they ask, where can you get information from if you have this disease or you have questions? So, the videos I just showed you, or the picture I just showed you. But if you look at this nice little pamphlet, click the link down below, and it's a pamphlet. Mine is in black and white. You guys are in color for more detail. But the pamphlet goes over everything we went over, all of the objectives we went over. And on the back side of the pamphlet, if you'll look here, you'll see the information for the CDC and all the references that we use in this video to make this. And like I said, this is a good reference guide, and your local health department is good as well. So you ask, is gonorrhea contagious? Yes, it is. What are one of the symptoms of gonorrhea? Discharge, painful vaginal discharge, or even penile discharge. Do most people know they don't have it? Men don't know they have it, but women sometimes, men know they have it. Yes, women also. So they're symptomatic because they have a smell. So there are 98 million people in the United States who have tested positive for gonorrhea. That's a lot. What gender caused the highest spread? Men. No, I'm sorry. The gender that caused the highest spread of gonorrhea is women. Can gonorrhea cause cancer? No. If contracted, can gonorrhea spread to an unborn baby? Yes, it can. And we also talked about testing. So I want to thank you guys for listening to my presentation. So if you'll click the link below, you'll see my post test about this video. And I just want to thank you guys for taking the time to listen to my video and look at my pamphlets on the information that I gave. This is my last video, so I'm signing out. Felicia McNeil, Dr. Lucky's class, Community Health Project, LPN to BSN student. Thank you so much for your time.